I'd like to focus today on what sometimes is a bone of contention that arises between the individual physician and the hospital or hospital system or large practice in which they work with regard to differences in how they would manage a particular patient. We're seeing this more and more. It's basically inherent in the system, and I think it causes sometimes problems that are avoidable. I think there are a couple of principles that, if one keeps them in mind, it can mitigate any disagreements that occur and lead to a successful conclusion. I think that the main principle is that one needs to focus on the patient and what's best for the patient. Again, not on your job, your particular role in this, but on the patient. Uh, Along those lines, try hard to not framing this as a dispute between the provider and the system. Disagreements are a given and can be dealt with, I think, effectively if one keeps in mind certain principles. For example, if there is a disagreement as to the management of a patient, um, how many patients you need to see per hour, what tests can and cannot be ordered, I think those difficulties should be or disagreements should be communicated early and directly between the involved participants. Listen to the other side. Listen to what they are saying. Um, they have, like the physician, a goal, which is what's best for the patient. Sometimes that gets forgotten by the individual provider. Um, Use objective evidence in explaining why you think more time is needed, more tests are needed, et cetera, et cetera. And avoid personal disagreements and absolutely avoid uh, motives for why you feel the way you do and why you advocate a course of action. The only motivation on both sides, or if more than two sides are involved, should be what's best for the patient. Um, the roles should be clear about uh, who's accountable, and keep in mind that, God forbid, if a matter comes to court, ultimately it's going to be both that could be named as defendants, and certainly the physician and the care that he has rendered. It's going to be it's a weak argument that I only did my job and it was up to the system. You're supposed to be an advocate for the patient. Uh, Promote a transparency for your actions and use interdisciplinary problem solving. Communicate always with respect and professionalism. There's no role at all for name calling or impugning the motives of a person who feels differently about the management of a patient. Present the facts, state the goals, which should be about which there should be unanimity of opinion. Um, Identify areas of agreement, because there are often more areas of agreement than disagreement. Um, Patient-centered solutions are key, and needless to say, any decisions and the rationale behind them should be well documented. There shouldn't be an argument or a debate in the chart. These things, like many things in life, are best handled by direct, personal, one-to-one contact. I think once a resolution has been determined, that should be documented in the chart. But as we've seen so often in medical malpractice, debates or argument in the record are not helpful to anybody. I think that if you follow these principles, a lot of these spats, I'll call them, will melt away. If one keeps in mind, again, the larger goal, which is the patient, and what basically all providers or all participants in the system want, which is what's best for the patient. So that, I think, that's kind of a framework for resolving these little disputes. Patients should be kept informed, but shouldn't be active participants in resolving these disputes. I think it's important to keep in mind that the participants in these disagreements about management of a particular patient or a situation all have their hearts in the right place. Doctors want to do what's best for the patient. Hospital systems want to do what's best for the patient. So, which is why I say a lot of these things, which are basically sophisticated forms of turf battles sometimes, kind of melt away once that's kept in mind and that's communicated to the other parties. Doctors can sometimes feel like the system, quote unquote, is out to get them, and that's not true. They're there to help. Systems, large practices definitely feel like doctors are trying to do the right thing. So that should always be kept in mind.